Good evening. In this lecture we will talk about causes of normocytic anemia. Normocytic anemia can be defined as anemia with normal MCV, which range from 80 to 100 femtoliter. Causes of normocytic anemia can be divided into either non-hemolytic anemia, such as anemia of chronic disease or aplastic anemia, and hemolytic anemia. إيش نقصد بالهيموليتيك؟ نقصد بها increased destruction of RBC. Hemolytic anemia همين تتقسم into either intrinsic or extrinsic. الintrinsic نقصد به إنه ال cause of hemolysis presents inside the RBC، يعني سبب destruction يكون موجود داخل ال RBC. من أمثلتها ال defect in membrane of RBC، يعني membrane of RBC يكون بخلل يسبب الهيموليسيس، مثل ال hereditary spherocytosis and paroxysmal nocturnal hemoglobinuria. Or enzyme deficiency inside the RBC will cause hemolysis, such as glucose 6-phosphate dehydrogenase deficiency and pyruvate kinase deficiency. Or the presence of abnormal hemoglobin that cause hemolysis, such as sickle cell anemia. Other example of hemolytic anemia include extrinsic hemolytic anemia. إيش نقصد بالextrinsic؟ ال cause of hemolysis present outside the RBC, such as autoimmune hemolytic anemia يصير destruction of RBC بسبب antibody that attacks the RBC. Or microangiopathic hemolytic anemia and macroangiopathic hemolytic anemia and infections. In this lecture we will discuss aplastic anemia in more details، اللي هي من أمثلة non-hemolytic anemia ما يصير بها hemolysis or destruction of RBC. Aplastic anemia نقصد بها ال failure of bone marrow or bone marrow unable to produce hematopoietic stem cells، يعني bone marrow failure. Aplastic anemia can be divided into either acquired or inherited. The acquired could be subdivided into either primary or idiopathic، يعني الكوز مالته unknown، or secondary aplastic anemia، secondary acquired aplastic anemia. The examples of inherited aplastic anemia include Fanconi anemia or Schwarzman-Diamond syndrome. Regarding the causes of secondary causes of aplastic anemia، يعني اكو بعض drugs or disease يسوي destruction للهيماتوبويتيك stem cells and result in bone marrow failure. مثل هاي causes هي drugs include cytotoxic drugs، يعني drugs اللي يستخدموها against cancer، or anti-rheumatic drugs drugs that use against rheumatoid arthritis مثل methotrexate، anticonvulsants، immunosuppressants and antibiotic. من الانتيبايوتيك المهمة اللي دائما من يستخدموه يخلون ببالهم الريسك of aplastic anemia هو الكلورامفينيكول. Other secondary causes of aplastic anemia include chemicals such as benzene or insecticides. insecticides نقصد بها المبيدات الحشرية. Other cause of aplastic anemia include hepatitis virus, human immunodeficiency virus, Epstein-Barr virus and human herpes virus number 6. Other causes include chemotherapy and radiotherapy and autoimmune diseases such as SLE or rheumatoid arthritis. Regarding pathogenesis of aplastic anemia, there are many theories that support the pathogenesis. One of these theories includes decrease or reduction in the number of regulatory T cells. Regulatory T cells are responsible for suppression of immune system and maintain self-tolerance. إيش نقصد بالself tolerance؟ نقصد به إنه regulatory T cell prevents cells of immune system to attack self antigen، يعني تمنع الautoimmune disease. من تقل regulatory T cell راح يزداد number of autoreactive cytotoxic T cells and increase release of inhibitory cytokines such as interferon gamma and tumor necrosis factor from T helper 1. These inflammatory cytokines will cause suppression and apoptosis of multipotential hematopoietic stem cells. يعني راح تسوي destruction and death of source responsible for production of RBC, white BC and platelets. This results in pancytopenia. Pancytopenia نقصد بها الأنيميا يعني decrease production of RBC, thrombocytopenia decrease number of platelets, and neutropenia or monocytopenia which means reduction in white BC count. يعني كملخص للباثوجينيسيس of aplastic anemia عندنا autoreactive cytotoxic T cell راح تسوي destruction للsource of RBC, white BC and platelets that result in pancytopenia. Regarding a clinical feature in patient with aplastic anemia, the patient will present with signs and symptoms of anemia such as pallor, weakness, fatigue, dyspnea with exhaustion and tachycardia. The patient also presents with signs and symptoms of thrombocytopenia or decreased platelet count such as petechiae, bruising, gingival bleeding and epistaxis. The patient also has more susceptibility to infection, so they will present with fever, chills, pharyngitis and other infection. يعني البيشنت with aplastic anemia يجي with a triad of symptoms and signs اللي هي anemia, tendency to bleeding, tendency for bleeding, and increased susceptibility to infection يعني يكون معرض أن يصير عنده infection. Regarding investigation for aplastic anemia, these include first complete blood counts. بالcomplete blood count راح نشوف decrease in RBC count, decrease in platelet count, neutropenia يعني decrease in neutrophil count, and decrease in reticulocyte count, and decrease in lymphocyte. طبعا الليمفوسايت بالبداية راح نشوفها normal لأنه هي آخر type of cell يصير بيه نقصان بالأبلاستيك أنيميا. بعدين نشوف lymphopenia يعني decrease amount of lymphocytes. in bone marrow examination ممكن نسوي bone marrow aspiration يعني ناخذ sample من البون marrow and visualize it under microscope. نشوف fat filled spaces يعني bone marrow filled with fat cells and few hematopoietic stem cells يعني تكون الستيم سيل قليلة بالبون مارو aspiration. بالبون مارو biopsy نقدر نحدد السيلولاريتي of bone marrow يعني نسبة الفات to cells. طبعا نشوفها هايبوسيلولار يعني الفات أكثر من السيل. الهايبوسيلولار هي أحد الكرايتيريا اللي من خلالها نقدر نسوي diagnosis للأبلاستيك أنيميا. Other investigation to find the cause. احنا مثل ما قلنا secondary causes of aplastic anemia include drugs, infection, autoimmune disease. فنسوي investigation حتى نعرف ال cause of aplastic anemia إذا كان secondary. من أمثلة هذا investigation نقدر نسوي screening for viruses لأن احنا قلنا اكو viruses مثل ال HIV والهيباتيتس والإبشتان باير فيروس ممكن نسوي aplastic anemia فنقدر نسوي screening حتى نعرف الكوز. This picture demonstrates cutaneous bleeding يعني bleeding in the skin ونقدر نقسم ال cutaneous bleeding into either petechiae or purpura according to size. فالبيشنت اللي عندهم thrombocytopenia or decreased platelet count يصير عندهم قابلية للنزف. This microscopic feature of bone biopsy demonstrates normal bone marrow. تلاحظون النسبة of fat cells to hematopoietic stem cells normal. This microscopic feature of bone marrow biopsy demonstrates hypocellular bone marrow. Hypocellular يعني ratio of fat cells more than hematopoietic stem cells. تلاحظون إنه البون marrow أغلبه fat cell. Regarding differential diagnosis of aplastic anemia, these include myelodysplastic syndrome. بالmyelodysplastic syndrome راح يصير abnormal formation of myeloid lineage or paroxysmal nocturnal hemoglobinuria. بالparoxysmal nocturnal hemoglobinuria راح يصير abnormality in RBC membrane or acute leukemia نقصد بها presence of immature white BC more than 20% in bone marrow. حتى يميزون الأبلاستيك أنيميا عن المايلوديسبلاستيك والبي ان اتش والأكيوت لوكيميا خلولها كرايتيريا. These criteria include reticulocyte count from 0.5% to 0 يعني الريتيكولوسايت تكون كلش قليلة قد توصل 0 and absence of cell abnormality on blood film يعني من ناخذ peripheral blood smear نشوف ال RBC ال white BC and platelet normal بس عددها قليل. بس في حالة المايلوديسبلاستيك سيندروم لا، ممكن نشوف ال RBC بها رينج داير ما داير يسموها سيدروبلاستيك رينج، أو في حالة الأكيوت لوكيميا قد نشوف بلاست سيلز اللي هي immature cell in bone marrow large cells with large nuclei. فالنورمال cells on bone marrow هي تميز الأبلاستيك أنيميا. and the last criteria include marked hypocellular marrow مثل ما قلنا إنه نسبة الفات أكثر من نسبة السيل and these include the criteria of aplastic anemia. Regarding this case, a 30-year-old woman complains of recent easy fatigability, bruising and recurrent throat infections. Physical examination reveals numerous petechiae over her body and mouth. Abnormal laboratory findings include hemoglobin of 6 gram per deciliter, white BC of 1500 per microliter and platelet of 20,000 per microliter. The bone marrow is hypocellular and display increased fats. What is the appropriate diagnosis? So in this case we have 30-year-old woman complains of fatigue, bleeding tendency, and recurrent infection or recurrent throat infection. This triad reflects that the patient has pancytopenia. يعني من تشوفون إنه البيشنت يجي with sign and symptom of anemia, bleeding tendency و recurrent infection خلوا بالكم إنه البيشنت عنده pancytopenia. Complete blood count reveal the presence of anemia لأنه الهيموغلوبين مالتها 6 gram per deciliter and normal hemoglobin from 12 to 16 gram per deciliter. The patient also has leukopenia or decrease in white BC counts لأنه normal white BC counts is from 4,000 to 11,000. And the patient also has a thrombocytopenia يعني عندها number of platelet قليل, normal platelet from 150,000 to 400,000. So the patient has pancytopenia. شلون عرفنا من الهيستوري and complete blood count. The patient also has hypocellular marrow and display increased fats مثل ما موضحة بهاي الصورة. تلاحظون إنه البون marrow biopsy هو hypocellular والnumber of fat cells more than hematopoietic stem cells. So the presence of pancytopenia plus hypocellular bone marrow are diagnostic for aplastic anemia. And this includes our lecture today. Thank you for your listening.